You guys are in for a real treat tonight. Today we talk drug dealing basics 101 with focus on distributors. Guys, get your head out of the gutter. We're talking healthcare here. Biopharmaceutical distributors. So today's topic is biopharmaceutical distributors. We'll talk about why are they important in the industry itself, in the healthcare industry. What is their relation to biotech and pharmaceutical companies? And lastly, who are some of these players? So with that, why are biopharmaceutical wholesaler and distributors important? Well, in the overall landscape of healthcare, one of the things that's used to provide services, healthcare services to patients is drugs. And so with this, it's important obviously to manufacture them. That's what the job of the biotech and pharmaceutical company is. But after you manufacture it, well, how are you going to get it from the place of manufacture to the place where it's being administered or where you're giving the drug to the patient? That's where wholesalers come in. Wholesalers are, as we talked about, they make sure drug gets from manufacturer to the site of administration. Their purpose really is to make more efficient. They're kind of like middlemen. They make more efficient the process of transacting. So rather than each provider or place that a drug is being sold going to the manufacturer to buy something, rather these companies, you go to the wholesaler. The same idea behind, you don't go to each individual farm to pick up your meat, your dairy and your bread. Rather, you go to a supermarket. The same type of idea is what is used as the distributor in this whole model. So with that, wholesale, so that's the service that they provide, is really that they go about and they source from all of the different manufacturers, and they oftentimes will end up warehousing drugs in a particular location and then sell from this warehouse to the providers that they need to. So again, middlemen, and they really kind of pull in all of the drugs from the manufacturer's warehouse and then ship it out to the either the pharmacies, the hospitals, the long-term care providers, so on and so forth. So that's kind of what they do. Now we talk a little bit about who are some of these players. Well, McKesson is a really good example, large company that does this. AmerisourceBergen, Cardinal Health. These are some of the large players. And one of the things that you may intuitively think about would be that, well, it would make sense that there's only a few of these wholesalers. And that's true. The reason being is that, again, the same type of idea with supermarkets. There's not hundreds of supermarkets out there. There's a few big chains, and that's kind of the way the wholesaler distributor model is, that there's a few big companies that end up dominating the space and dominate the sales for it. Now, what do wholesalers and distributors do with relation to biotech and pharmaceutical companies? Well, we talked a little bit about this earlier. So biotech and pharmaceutical companies, the manufacturers, they make this drug. They make a drug X, and they sell to the wholesaler. The wholesaler in turn then sells it to all of the other parties. But in turn, so there's a transaction ongoing between biopharmaceutical company and wholesaler. And so biopharmaceutical company, let's say Regeneron, for example, selling their product Eylea, which is indicated for wet AMD. It's an eye disease. So in this example, let's say AmerisourceBergen, I'll be AmerisourceBergen, and this outside entity over here will be Regeneron. So I go to Regeneron saying, I'd like to buy 1 million units of your product Eylea. And let's say, just for the sake of this whole thing, it's $100. Now it's not $100, it's probably in the thousands, maybe tens of thousands of dollars. But just for this example, we're going to keep it simpler. So as AmerisourceBergen, I go to them and I'm like, I'd like to buy 1 million units of Eylea at $100 a vial, so I'm spending $100 million. Now, I have that warehoused, and then I'll end up selling that to all of these different parties that on my end in order to get paid back and make some profit on that. For doing my job, though, so not only am I just shipping out drugs to XYZ, but I'm also capturing that data. So I input into my systems, okay, we sold 1 million units to, we sold 100,000 units to CVS, another 100,000 units to Walgreens, another 100,000 units to XYZ Hospital. So I'm taking all of this data as to who did we sell to, what was the quantity that we sold, what was the price that we sold it at, because I'm not selling the same price to everyone. There's actually very different prices that I will be selling to each of these parties. which can get complicated very quickly. But I pulled all of this data in, and I end up selling that data back to Regeneron. Well, why would Regeneron want this data? Well, for marketing, duh. I'm just kidding around. It's not a duh. It's kind of a duh, but it's not really a duh. But basically, Regeneron wants to come back and say, okay, well, this company is selling to all of these different parties. Well, we saw that they're selling to CVS. They're selling 10% of the business to CVS, another 10% to Walgreens, and then a very small portion of hospitals. Well, the manufacturer might want to increase their marketing and such to those pharmacies rather than to a hospital or some such thing. And again, this is a very oversimplified model. So this is not grounded in reality. I'm simply giving an example, and I wanted to use some drug names, some numbers, just to get a little bit more grounded and to make it make a little bit more sense. But this is not an actual case example. That being said, so we provide, AmerisourceBergen would provide data to Regeneron in this example, saying that, well, these are the types of companies that are purchasing this. This is what they're paying it at. This is how much inventory we have to get an idea of how fast is the product moving itself. This is the methods of distribution itself. And we'll also do some data processing to give them some analytics. So with that, we get paid a small service fee for pulling all of this information together and capturing it and sending it over to Regeneron. So there you go. This is a little bit about wholesalers and distributors. I hope you guys enjoyed this video. Let me know if you guys have any questions or comments. More than happy to address them as I'm able to. And with that, like, subscribe, share, and comments. Reach out if you got any more questions. With that, keep up, thrive, and stay sexy.